People going crazy.
I know. Anyways, I was going to wait till after, but whenever you make it here.
Okay. Okay, let me say good afternoon. We're going to get started today. I'm with the Chief Medical Officer for the City of Houston, Dr. Purse, and then the Director of Health and Human Services, I call it, for the City of Houston, Director Williams. And then a number of other special guests, Dr. Aisha Hilliard, who is here, Reverend Rodrigo Vargas, Pastor Max Miller, and also Angelica Ortega and Ernest Walker. And I'll be introducing them a little bit later. Let me say I want to extend my appreciation to the directors of the various city departments who are also joining us today. This afternoon, the Houston Fire Department announced the death of arson investigator Lemuel Bruce. He is the first Houston Fire Department arson investigator to be shot and killed in the line of duty. I want to express my condolences to his family, and from all accounts, and the people that I have talked to, he was an outstanding firefighter and arson investigator for the city of Houston. He was only 44 years of age, had been with the Houston Fire Department for 17 years and 5 years with the arson unit. He leaves behind his wife and 2 children, and we want to lift up that entire family. Please pray for them. This is a painful situation. Pray for the family of the Houston Fire Department as a whole, and especially for those firefighters and arson investigators who work very closely with him. And then pray for our city. In a few minutes, we will announce new safety protocols for sanctuaries and faith-based organizations as they begin to reopen in the Houston area this weekend. As many ways, it's kind of fitting as we talk about Investigator Bruce, that we also have many of our faith leaders who are here with us as well. And as we begin to reopen, but I want to share first the latest on COVID-19 in the city of Houston. The Houston Health Department reports 138 cases of COVID-19 today, bringing Houston's total to 79,964. There are 3 newly reported deaths today, bringing the city's total to 1,273. And earlier this week, our city reached its goal. We reported on Monday, reached a goal of a positivity rate for COVID-19 of 5%. I don't want to get too caught up, as Dr. Purse would say, on that 5%. The goal, quite frankly, is to get it down much, much lower than 5%. And so we are reminded that we have to continue to remain vigilant, to take the necessary preventive steps that led us to where we are today, recognizing that if we take these masks off when we're in the presence of others, if we fail to adhere to the social distancing requirements, as well as to the proper hygiene, just like these numbers can come down, these numbers can start to go back up. In fact, the TMC is reporting an uptick on some of its numbers, COVID-19, which is a reminder that COVID-19 is still in our community, and we have to continue to live with the virus and to continue to practice all of those measures that you have heard over and over and over again, and then take note of what's happening, for example, in other parts of our country, and that is as numbers have come down. When people get lax, the numbers go right back up. And so even in the state of Texas, we are seeing signs of that. So let me encourage people to keep these masks on, okay? And quite frankly, when the weather gets cooler, like today, then just view it as a glove on across your nose and your mouth. It will help to keep you warm, okay? So keep the mask on. And then I also want to remind Houstonians about the flu shot. Flu season is in full effect, and it is very important that you protect yourself and your loved ones by getting the flu shot. So to emphasize all of this and more, let me pause now and bring on Dr. Peirce.
Thank you, Mayor. And I would also like to start by sending my condolences to Investigator Bruce, the Arson Division, and the entire Houston Fire Department for the tragic events of this morning that cut very deep and are very painful to many, many people. And it's all about saving lives. So Investigator Bruce is out there doing something to try and save lives and protect the public, and that's exactly what the HER task force has done, put together a lot of work to try and protect our community and save lives. And we know that folks who today are becoming infected with the coronavirus tend to be younger people. And it's good that younger people don't get as sick, but they can then spread it to older folks. And then when I say older, that's not even that terribly older. We've seen deaths of people as young as 30 and below. But beginning about 40, 50 years of age, the risk goes up quite a bit. And so in our houses of faith, we have a lot of folks in those age groups. And so the HER task force came together and did a terrific job of helping compile the guidelines for protecting people and saving lives. And this was a lot of work. And I think at the end of the day, you know, we have to consider and recognize that at the end of the day, the things that are going to make the real difference in protecting lives are those things that we as individuals do. And in my line of work, there's a phrase that says that all disasters actually happen locally. So whether it be a tornado or a hurricane or even a pandemic, we look to government, local, state, federal for help. But what really saves and protects a community are those things that are done within the community. And here's a terrific example of the HER task force stepping in, stepping up, and coming together with guidelines that are going to undoubtedly save lives. The mayor also pointed out that the virus is not gone. And he's pointed out how the numbers across the United States and in particular right now Europe, they came down and they're starting to bounce back up again, and in fact across Texas. Now, here in Houston, our numbers are comparatively low to what they were just several months ago, but we're not immune to the rebound effect that we're seeing elsewhere. And so the effort of the HER task force today will help us keep these numbers low and protect people and save lives. And I just want to say thank you to everyone on the HER task force for all the hard work that they did. It was many hours, I'm certain, and I'm sure that while this may not look like, the document may not look 3 inches thick, I'm sure that there's 3 inches thick worth of work that went into it. And so thank you very much for doing that and for protecting people. Mayor?
Thank you, Dr. Peirce. And before I turn specifically to the task force itself, Director Smith, why don't you just give us a reminder on the testing sites and the fact that they're still open? Because I don't want, get your flu shot, but you also need to get tested as well.
Well, before talking about the testing sites, I want to acknowledge the work of the HER task force. What Dr. Peirce did not acknowledge is that he and I both had an opportunity to read the document, and we're grateful for the work. I think it's exceptional guidance. Also, just to reemphasize what the mayor and David is saying, is that when you look at our numbers, they do look good. We're going in the right direction. But when we look around what's happening in Texas, I've had communications with a number of my colleagues across the state where they're actually are seeing increases. And so I think that we need to be continually vigilant in our work, continue to be masked, continue to social distance, and also use excellent hygiene in our practices. I want to also acknowledge the work of the Houston Health Department and the now 1,600 to 1,700 people that have been working for about 7 months and facing this challenge related to COVID. We continue to operate various testing sites throughout the community. Mainly, our department is operating mobile testing sites, but if you go to our website, you will see that we have a host of partners that are, in fact, operating testing sites 6 days a week. The testing numbers have increased over the last week or so, and we're really fortunate for that, but we want to encourage people to take the opportunity to test as on a routine basis, actually, because today you could, in fact, take a test, have interactions with folks, and 2 days later, the results of those tests might be completely different. So we can continue to encourage people to take advantage of the testing opportunities that are out there.
All right. Thank you very, very much. And so testing is important. I think I've been tested maybe about 10 times. I think I've got another one that's scheduled coming up fairly soon. So please do that. Now let me bring this, the members of the task force, at least the leadership team, forward. And so again, let me call on Dr. Arisha Hilliard of New Light Church, Reverend Rodrigo Vargas of Union Houston, who are members of the task force, Reverend Max Miller of Mount Hebron Missionary Baptist Church, Angelica Ortega of the National Association of Christian Churches. Listen, it's not a time to be bashful. And Ernest Walker, General Manager of KTSU Radio 90.9. The representative of the HER Task Force, I do want to acknowledge Shannon Buggs, who is the Director of Complete Communities, and then Janice Weaver, who is giving direct leadership to the HER Task Force. Okay, and I'm holding the document that they have put together and spent a lot of time, a lot of effort, a lot of discussion, a lot of debate, and we've gone back and forth. And then let me just say from the very beginning, these are guidelines. They are not mandates. They are guidelines that we offer for people to consider as people start to, certain faith-based worship institutions start to reopen in person. So these are guidelines, intended to be guidelines. It was recently announced that sanctuaries and faith-based organizations will begin to reopen in some of our faith-based institutions in the Houston area. Today, I'm joined by leaders of some of the largest and most important faith-based organizations in our city. They are part of the Faith and Community Leaders Subcommittee of the Health Equity Response Task Force, launched by this administration in April of 2020, and have been instrumental in providing insights, but most importantly, spiritual guidance during this time of crisis. They have supported us in creating a very comprehensive guide to reopen all places of worship safely. For months, congregations of various denominations have used technology as a tool to provide spiritual guidance and provide support to the community, and let me say thank you. As various places of worship reopen this weekend, some will open, some will not. Some will continue to be remote and operate virtually. I would like to share some critical guidelines for preventing the spread of COVID-19. It is important to know that three main questions were answered in creating these guidelines. One, how can we protect congregants, staff, and volunteers who attend the service? Two, how do we assure our communities we are doing all we can to protect them? And three, how do we minimize the risk for transmission? I want to emphasize an essential component of these guidelines, which is the maximum occupancy for each worship service. Our recommendation, and let me underscore, our recommendation is to reopen at 25% capacity and consider offering pre-registration options for attendees. We advise placing signs stating in the parking lot, starting in the parking lot, directing people where to go, what entrances to use, and what directions to go to avoid conglomerations, gatherings. People speaking about parking lots, we also recommend blocking a few parking lot spaces to prevent people from getting too close. All surface areas, such as the doors, door handles, handrails, tables, and chairs, should be cleaned and disinfected before, during, and after service. We also encourage individuals to avoid sharing the audio-visual equipment used for services, like the microphones, instruments, and pulpits, as well as the removal of shared items like hymnals, pens, and offering envelopes. Houses of worship come in all sizes and shapes. We know each congregation will incorporate guidelines, including temperature checks and having hand sanitizers available. So these are guidelines. The important thing is that still the wearing of masks, the social distancing, the proper hygiene, all of those elements are critically and very much important. And now let me invite Dr. Arisha Hilliard of New Light Church, who will tell us more about the guidelines implementations. Dr. Hilliard.
Thank you, Mayor Turner, and I just want to first say thank you to the entire task force and the community leaders. They're made up of various denominational groups, various pastors and leaders from around the city of Houston, and so thank you to the HER task force for their wonderful efforts, and additional thanks to Director Janice Weaver. While we know that there's a tradition of separation of church and state, we wanted to do everything that we could to support Mayor Turner in his efforts to control the spread and decrease the spread of COVID in our area. And so we thought about every situation, from our children's areas to our teen areas, our lobbies where we congregate, and then encouraging everyone to continue to wear their masks while they're in service. And so I just want to again say thank you to Bloomberg Associates, and make sure that you reach the resource at HoustonCovid-19Recovery.org for more information. And thank you all for participating and continuing to keep your churches safe and have a spiritual worship experience at the same time. And I give it back to you, Mayor.
Thanks, Dr. Hilliard, and thank you for your leadership. And I also want to thank you and Reverend Vargas and others, Pastor McMillan, for the town halls that we've had on mental health. That's been very, very critical. Now let me also call on Reverend Rodrigo Vargas of Union Houston Speaks.
Thank you, Mayor. It's an honor and a privilege to be on this task force to make our city better. I want to thank the leadership of Dr. Arisha Hilliard, Ms. Janice Weaver, Mayor Turner, for the opportunity to invest our time, our innovation, and our faith into making our city safe, secure, at the same time respecting worship centers. Me gustaría darle gracias al Mayor Turner, Dr. Arisha Hilliard, la señora Janice Weaver por darnos la oportunidad a las liderazgo de fe, gente de todas razas, gente representando la comunidad hispana, para poder trabajar juntos como seres humanos con la intención de participar en un centro de alabanza, pero a la misma vez participar en la precaución de COVID-19. Así que ha sido un placer, muchas horas, muchas reuniones y inversión hemos hecho. Esperemos que todo esto que hemos hecho le hace más fácil y le da seguridad a la comunidad hispana para poder congregar una vez más y alabar en su fe. Le damos gracias a toda la gente que participó y ha sido un honor. Muchas gracias.
Thank you. That was one other thing I was thinking about, but I noticed that you included it in that last part that you just said. So I was following you along to make sure that you checked off all the boxes. But in that last paragraph, you included what I wanted you to say. So muchas gracias.
I told him he was going to do that.
God is good.
Yes, he is all the time.
Pastor Max Miller, you want to come and make a quick comments? Pastor Miller.
To our mayor, to the leadership of this task force, and to the directors, Mr. Weaver, it has been a privilege to serve with such a team. Not only did we take our time, we attempted to make the best interest of each and every church, regardless of the size. Because in the eyes of God, every church is a large church. Amen. But the lives are so precious, and we dare not have the membership to come back and walk in a state of somnambulism. But we wanted to make sure that each and everything that we could think of was covered. As the mayor has said, it is not mandatory but it just makes good sense to follow the guidelines. Even though we're down to 5%, which we have all been applauding, when the death is in your family, the 5% looks like 500%. So we ask, we plead, we encourage, and we challenge that we take these guidelines seriously, that we utilize the guidelines, and let's hang around here and see what God is up to.
I want to reiterate the importance of following behaviors so we have all grown accustomed to. Wear a mask, wash your hands frequently, maintain social distance, and get tested. I will close by reminding everyone that worshiping is about caring, particularly in a pandemic. Worshiping is about protecting each other. And things will be different from the last time you attended your shrine, but remember that the small inconveniences will prevent the major disappointments of possibly contracting the virus and putting lives at risk. Remind your congregants and parishioners that worshiping is an act of faith, and all who walk through those doors is a willing participant to these new guidelines. Now, I want to thank you for adhering to these new guidelines, and thank you for continuing to help our community during these very difficult times. And before I open for questions, I want to remind Houstonians about early voting, which is going on right now until October the 30th. I'm very happy to announce that Harris County has been shattering its single-day early voting records for the past 3 days, and people everywhere are sending a message about their willingness to stand up and make their voices heard. This is the most important election of my lifetime, certainly, and I looked at the face, I started to say something, but in the midst of these faith-based leaders, let me be truthful. You know, we must, let me just skip that line. We must continue showing up to the polls and voting all the way down the ballot. And voting is a fundamental right and the most powerful way to express ourselves. Having said that, we'll take questions either to this group or to Dr. Purse or Dr. Williams or any of us. Any questions?
To Dr. Hilliard or any of the members of the faith-based community out there, I'm just curious as to what is the moral responsibility of a place of worship in deciding what these guidelines are? Where do you begin? You mentioned the difference between smaller congregations and larger congregations. There are socioeconomic differences that factor into that. So just walk us through the process of deciding what needed to be what in determining how places of worship will reopen their doors, and the moral responsibility that's there.
Well, we looked at several factors when we were laying out the guidelines. One was first just protecting and keeping everybody safe. You also wanted to look at the population that is at risk, and you didn't want them to have to put their faith in question by not being able to attend and not being able to come into a safe environment. And so while we wrote the guidelines of social distance and wearing your mask and making sure that people sat certain ways, whether you had chairs or pews, we also took into consideration just where everybody was in the society and how to make worship still an act of faith, but a comfortable, safe experience. And we shouldn't have to risk our lives to lift up our faith in our God that we serve. And so that was one of the things that we looked at. We also looked at the CDC guidelines and looked at the trends that were going on. One of the things, when our city hit the high alert, as a faith leader, I even closed my service and went back to virtual, because I think the moral responsibility is not just did I have a good service, but did I make sure that my parishioners and my members were safe, so that Monday through Friday, Saturday, that they still are alive and not at risk and don't have to go on your sick and shut-in list, like we like to call it in the church. And so that's the moral responsibility. While I want to teach you the word and teach you faith, I still want to make sure that you're safe and that you understand the resources and the guidelines that are available to you.
And also in Espanol,
One of the things that's really important that I've been telling our congregation is that the safety of the flock. A pastor is supposed to lead a flock through valley, mountain, desert, and oftentimes sheep are exposed to rain or hot sun, or they get thirsty. This is no different in that if a pastor saw some sheep getting sick from drinking out of a pool, the pastor would make sure to remove them from that or protect them from not drinking that. In the same token, it's the same thing. The second thing I'd like to say is that oftentimes we got a little pushback on the wearing masks during worship. One of the things that I think a lot of people miss is that oftentimes we make that claim from a very westernized position, not realizing that Jesus Christ was a Middle Eastern who wore a scarf most of the day because of the dust, the infection, and the smell of dung that was going around. And so they would wear masks. This is not about a lack of faith, but rather the opposite. It's about having enough faith to care for people, to be a little inconvenienced to make sure that we get through this together as one people and one body. Muchas veces durante esta trayectoria que hemos pensado en cómo abrir de vuelta los centros de alabanzas, hemos pensado bastante en que la prioridad de un pastor es mantener la seguridad de sus ovejitas. En este caso son personas. Como un pastor protege a su oveja en el valle y en la montaña, es la misma manera que nosotros como líderes de congregaciones tenemos que proteger a la gente. A la misma vez, muchas veces vemos que usar una máscara puede ser no tener suficiente fe, pero en realidad cuando vemos el Jesucristo a través de los ojos del Medio Oriente, vemos que Jesucristo usaba una bufanda a través de su cara, cubriendo su nariz y su boca. No es, la fe de nosotros es tener suficiente fe de estar un poquito incómodo por unos meses para proteger a la comunidad. Thank you.
Excelente. Any other questions? Yes, sir.
I'm not sure if this might be for Dr. Peirce. We know that there might be some feelings from families that, going to church might be a super spreader event. Can you maybe explain to people at home as they're choosing whether or not that this is safe for their families, what we've learned about church service during the pandemic, and also has there been any sort of contact tracing that your office has seen that has led to any outbreaks in the Houston area from congregations?
And let me just say, as Dr. Peirce comes, because even restaurants, for example, now in the city of Houston are, based on the governor's orders, up to 75%. The recommendation from these guidelines is 25% as we move forward. So along with the masking and the social distancing, all of the things that we are doing on a day-to-day basis, and so the church is the same. I mean, even being more conservative in terms of these guidelines. And recognizing that all institutions are different, but these are basic guidelines. But let me.
But to go off of that, Lakewood Church is going to have more than 4,000 people there on Sunday. Restaurants don't have 4,000 people in the building.
Right.
So I think that's why there's some concern that there could be a super spreading event.
Right.
That's all I'm asking.
Right. But Lakewood also holds over 17,000 people, and I think the figure that Pastor Osteen is using is 25%. So it's 25% of his capacity, which means they can spread out. So he's going from, let's say, 17,000 plus and 4,000. I think he's using the pre-registration as well. So what he's doing is consistent even with these guidelines. But again, these are guidelines. We can't mandate anybody to do anything. There is separation in church and state. But these are guidelines that these faith-based leaders and others have spent a lot of time. There's been a lot of discussion, going back and forth. So, but Dr. Peirce, why don't you come?
Thank you, Mayor. And you raise a really good question. So when we talk about super spreader events, the reality is that an event isn't recognized as a super spreader event until after the fact, when there are multiple cases that can be all linked back to that event, right? So moving forward, we need to look at the number of people that are in a venue and how big is that venue. And so again, we talk a lot about don't focus in on the numbers. So it's really the density, how many people, how close are people. And so if you have a large, whether it be a church or a restaurant, and let's talk about a restaurant for a minute. If the restaurant's supposed to be at 50% capacity and the restaurant manager simply closes half of the restaurant floor and fills the other part 100%, that technically would be 50% occupancy. But that completely defeats the purpose of what we're talking about. It's about keeping people separate. And we talk about, sporting events and it's stadiums. So you can have family units where they may, mom, dad, and the kids are together. They don't have to be necessarily 6 feet apart, but that family needs to be a good distance from the next family. And so it's common sense and thinking things through, and we all know, everybody now knows, should we wear the mask, the hand hygiene, the greeting hygiene with the elbow, but certainly not handshakes, and just remaining separate. So the venue, the number of square feet, and the number of people, you can eyeball it, actually. You don't have to get out a calculator and a ruler and all that. You can basically, we've all gotten good at it at this point. But a super spreader event isn't identified until afterwards. And so I think the work that is done here is really designed so that people will feel comfortable and safe going to houses of faith and congregating, because somebody's paying attention and making sure that it's safe before they even get there.
Do you have any guidance in terms of singing during service? Because I know the CDC back in May had suggested not doing that. It has since changed its course. What do you tell people?
Yeah, so another good question. So it really goes to, remember, the virus is spread in those little water droplets that come out of your mouth. And so if your nose and your mouth are covered and you're talking, it should catch most of it, right? And the same thing with singing. Now, you pull it down a little bit, that's a completely different story. So it really needs to stay up over the nose and the mouth. And if you're singing, it should be fine, right? It's going to catch most of it. And the mask that you wear protects you a little bit from the person next to you, but mostly it protects the person next to you from what would be coming out of your nose and mouth. So the mask up over the nose and the singing. Now, some people may be able to bellow a whole lot louder than others, and that's great. But if they're wearing the mask properly, it should still catch all those droplets.
Let me just say, in reading the document, it covers that as well, even the singing bit. And the other thing that I want to make note is that we have several options. You can go without providing any guidelines at all, but people are going to do what they're going to do. Okay? So if you don't provide any guidelines, then everybody is doing their own thing. What a number of people have been asking is that, Mayor, what do you suggest? Give us some guidance. And this task force, made up of faith leaders of all denominations, have taken the time and gone through it and been very meticulous, looked at the CDC requirements, and they've put together some pretty good suggested guidelines on how to proceed. So you can say, and you can be silent, that doesn't help the situation, especially when people are looking around and they're seeing some other things that are opening up, and they're saying, why not faith-based institutions? Okay, or we can provide the people with some suggested guidelines based on the science and health professionals to give people at least some degree, some roadmap on how to move forward in a safe basis. And I certainly want to thank all of them for just being very meticulous and very detailed in putting together this document. And I would suggest people read it. Okay. Oh, it's also online. Okay. Any other questions? Thank you all, and be safe and enjoy the I was trying to say warm weather. Oh, go Astros! From being down by 3 and now being 2-3, and we'll take it one inning at a time. So let's win today, and then tomorrow we will assemble the faith-based leaders again. So thank you. Please keep Arson investigator Lemuel Bruce and his family in your prayers. Thank you so very much.